Hi, my name is Jessica Clark, and today I will be presenting on behalf of myself and Francis Curry our evaluation of a bariatric surgery guideline using the AGREE-2 instrument. To start our evaluation, we decided to establish a threshold of 70% across all 6 domain scores to evaluate whether or not we would choose to recommend this bariatric surgery guideline. Our first domain involved the scope and purpose of the guideline and how clearly it was defined, the health questions covered, and the population covered. This was by far our highest scoring domain, and we felt that the authors did a good job of covering the scope and purpose of the domain. As you can see, we scored it a 92%, which was well above our threshold. Some of the things, and this was our strongest domain, and in fact the only one above our defined threshold, we did feel that it was clear and concise in terms of its objective, and the population both of practitioners and patients was clearly defined. The only thing that gave us any points off in this area was that benefits or outcomes were not very clearly stated. And some of the information did not appear in the sections that you felt it should appear. Our next domain was stakeholder involvement, and in some ways this domain scored very well, but there was one glaring item that was completely not considered, and that was 5. And that led us to a score, a total score of 26 points for this domain, which rounded out to about 56%. That item 5 did talk about the views and preferences of the target population, and those were not sought and not discussed at all in this guideline. It did clearly state the target users, but did not take into account any of their views or opinions. Additionally, the members defining this guideline were not stated. There was no specific committee. Even though many of the contributors were listed, there was no clear indication of what their role was in developing the guideline. Domain 3, rigor of development. Although there were some items that we had somewhat different scores, ultimately Francis and I had a very similar developing goal evaluation, of this domain, and we both scored it, as you can see, 35 and 34, a total of 69, which gave this about a 55% domain score. There were some topics, like I said, that we had some wildly varying group members, but it did tend to even out. Some of the things that brought this particular domain down was that there was no stated criteria or date to update the guideline. The strengths and limitations of the guideline were not very clearly described. The purpose or intent or methods of the reviewers was not listed. And the criteria for selecting the evidence, there was a recommendation grade level for evidence, but there was no inclusion or exclusion criteria listed to determine how they chose the evidence that they did. There was also no external review and no procedure for updating the guideline provided. For Domain 4, clarity of presentation, this was also one where we had some differences of opinion, which did ultimately bring our score down to about 25 points for this domain, or a 53%. Below our threshold. In general, it was felt that the recommendations were specific. However, there was not much discussion of any different options for management Um, Alternatives to bariatric surgery are not presented at all. Um, while the recommendations were easily identifiable to me, and then there was also an area later on where it listed them in a more concise manner. The clarity of how that presented led Frances to believe that it deserved a much lower score, and that's kind of how we differed there. I felt like they were there, and she felt like they looked as if they were in the wrong place. Domain 5, applicability. This was by far our lowest scoring domain. We gave it a 15% overall, and our scores were very similar. And most of this came from the fact that there really wasn't much about applicability in this guideline. So there were a lot of ones in this section. The only thing that gave it not completely ones across the board was that there was some discussion of contraindications or qualifying statements, but it even specifically states in the domain there is no implementation strategy provided for this. Editorial independence. This was also fairly low, although we did differ a little bit in this. We gave this ultimately a 58%. There was listing of the funding body's members, um, and some of them coincided with authors. And although it did talk about the funding body, there was no statement saying that it did not influence the guideline, which was pretty serious in our opinion, a pretty glaring withholding there. There was good discussion of the guideline development group members, and there was plenty of information on any kind of conflicts of interest that they may have. So we did end up ultimately giving that about a 50% score. In summary, as you can see, our threshold of 70% was only met by one domain. That was the first domain. And generally speaking, the other domains seem to fall in that 50% range. However, the glaring exception would be domain 5 regarding applicability. So even though it looks like none of these domains are meeting, some of them really did have a lot more information. They just didn't quite meet that standard. And we took that into consideration when we discussed the overall quality. When we did kind of a large scale look at what the overall score would be, it kind of came up to about a 52%. And we decided that that was about a 4. There was great information and recommendations included in this guideline, but there were several things that we felt like needed to be modified in order for it to be a recommendation that we would use. Some of that is greater discussion of alternatives. Bariatric surgery is one of many options that people who are morbidly obese have in order to become healthier. Also, a more clear and concise structure would make it more accessible and reader to practitioners who are researching this. And then another glaring issue that we had was there wasn't much information about stakeholders or patients and their views and opinions that was at all addressed during this guideline, which is important, especially considering the great toll that bariatric surgery and the great involvement that bariatric surgery patients have to have in this particular medical intervention. And then also, the application guidelines that were missing was definitely something that would need to be modified in order for us to make a strong recommendation for this guideline. Some questions. What domain was our strongest? That was definitely the scope and purpose. We felt that they described the target population well, and the medical condition was specifically stated. The weakest was the applicability domain, just because there wasn't any. And I think the thing that we both felt was most difficult our first time using this agreed to instrument was that it was very simple to grade or give scores of either 1 or 7, where all the information was there or none of the information was there. Those were easy. However, when there were items that had multiple criteria and some of it was present, some of it was not, it became more difficult to discern what score overall to give that domain and how to weigh the different criteria involved in each item. And so if there were a lot of criteria and some were there and some weren't, as a novice to reviewing, it wasn't always clear how much to weigh each particular criteria within the items.